Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Mr. Noble Mahomva is with me on the sign language desk. But first, let us have a recap of our COVID-19 numbers. This week, the highest number of cases globally was recorded in the Americas and European regions. By the end of last week, the top three countries with the highest burden of COVID-19 cases in the Africa region were South Africa, Nigeria, and Lesotho. South Africa continued to account for the highest number of all reported new cases in the Africa region. As of Thursday, 14 January 2021, Zimbabwe's cumulative number of COVID-19 cases was over 24,000, with over 13,600 recoveries, with a recovery rate of 56.3%. New cases increased by almost five-fold from 1,204 in the last week of 2020 to 5,576 in week 1 of 2021. While Harare and Bulawayo metropolitan provinces have recorded the highest burden of disease in the country, the burden of disease in the other provinces has continued to also go up considerably, I might add, with each province recording new hotspots throughout. Let me now turn to the four key issues or discussion points for today's update. The first one is on the nation's COVID-19 recovery rate. Many have expressed concern over the reported low recovery rates in recent daily reports. At the peak of the first wave in July 2020, recovery rates were reported as above 90% on average, but by the end of the day yesterday, the nation's recovery rate was reported as 56.3%. The recent surge in cases has put a big strain on provincial teams on tracking cases in order to appropriately and timely classify the case's clinical status. And due to these large numbers, provinces have tended to prioritize tracking of moderate to severely ill COVID-19 cases as these need urgent medical attention. But delayed tracking of positive cases that are generally well with no signs and symptoms but isolating and recovering at home has resulted in some recovered cases being included in the national recovery statistics a bit late, and hence giving the impression that the national recovery rate is low. A survey conducted by a team of global scientists in August 2020 confirmed that Zimbabwe's success in preparing and managing the first wave that peaked in July 2020 was mainly due to the stringent lockdown measures that were not only instituted very early in the epidemic, but were, for the most part, very well adhered to by individuals and the communities at large. The epi curve shows that the current second wave started at the end of November 2020 towards the beginning of the festive season. This is the time the nation became complacent and witnessed many illegal super spreader gatherings, events, and the sudden surge in cases a few weeks down the road, a few weeks later, around Christmas time, therefore came as no surprise at all. Measures that worked very well in managing the first phase, our first wave, are very known to us. We just need to comply to them. These include the staying away from gatherings, social distancing, wearing of face masks, and washing our hands with running water, with soap, and so on. We need to take this second wave, this second lockdown rather, as seriously as we did with the first lockdown. In other words, let us comply with the measures that we know work, that actually helped us manage the first wave well. We need to take the second lockdown and second wave as seriously as we did with the first lockdown. Unfortunately, it appears most continue not to take it seriously.
COVID-19 is real, with over 600 people having succumbed to the deadly disease in Zimbabwe so far, and over 25,000 cases having been recorded. Despite these scary statistics, a survey carried out by the ZBC News in several high-density suburbs, including Mavuku and Heathcliff, reveals that a number of people are not fully adhering to the stipulated World Health Organization regulations meant to stop the spread of the deadly COVID-19. Social distancing is still foreign to some citizens who seem to be moving around aimlessly, oblivious of the fact that the nation is under lockdown. Some people are not wearing their face masks properly in public places. These vegetable and fruit vendors risk the lives of their customers as they sell their merchandise without covering their faces with masks. They do not even have hand sanitizers. Elsewhere, pirate taxi operators go about their daily business ignoring the government directive to stop such activities according to lockdown level 4 regulations. Passengers could be seen in different scenes boarding pirate taxis without the requisite personal protective equipment. This manifestation of negative attitude is counterproductive as it curtails the efforts being taken by the government to stop the spread of the coronavirus. A complete behavioral change is needed in order to stop the spread of the COVID-19.
In view of the surge in cases and the reported new variants in South Africa and elsewhere, many have asked what they should do if they suspect that they have COVID-19. The World Health Organization has confirmed that measures to prevent and manage COVID-19 cases are the same regardless of the variant. Whether you have variant X, variant Y, those measures remain the same. Specifically, staying at home and self-isolating if you have mild symptoms. Avoiding contact with other people is very important. That's avoiding those gatherings. Always wearing a face mask to prevent the spread of the virus to others, and of course washing your hands with soap and running water or sanitizing them with an alcohol-based sanitizer. And yes, eating healthy meals, drinking lots of water to remain hydrated, and taking those medicines that help relieve the signs and symptoms for mild conditions. You must also call your doctor or your healthcare worker or the Ministry of Health and Child Care on their toll-free number 2019, or the Youth Advocates, their helpline, a toll-free number of 393, to get detailed guidelines on what else you need to do if your condition gets worse. Remember, you're at home if your signs and symptoms are mild. This takes me to key issue number 4 for today's update, the question of home remedies in the management of COVID-19. Many have asked about this. Let me, however, first remind you that currently there is no known drug or medicine that can cure COVID-19 yet. Management of COVID-19 cases is therefore mostly supportive and includes drugs, medicines, and remedies, home remedies as well, that relieve the signs and symptoms of this disease. So safe home remedies, once again, such as lemon tea, for example, that individuals have always found useful in the management of a common cold, can also be used in the supportive management of COVID-19 flu-like signs and symptoms. Finally, in view of the continued rise in cases with no end in sight yet, let us stay focused. work together, adhere to all the recommended preventative measures in order to end this pandemic once and for all. I urge you once again to stay at home, stay home, unless you have to attend to some essential service such as getting food and getting medical treatment. It is so critical you do that. Your life, that of your relatives, your friends, your neighbors really depends on it. Thank you very much.